We are sometimes asked, what is the role of a hospital CEO? Is it the same as being the CEO of Disney? In some ways, the answer is yes. Like the head of the Magic Kingdom, hospital CEOs work closely with other C-suite executives. The C-suite officers in a hospital like a corporation include chief financial officers, chief operating officers, and various vice presidents. A hospital will also have a chief medical officer who reports not to medical staff, but to the executive team. There are also chief nursing officers, CNOs. These positions focus on specific elements of facility operation, and their expertise allows hospital CEOs to make informed decisions. However, the focus should not be on making money, as the primary goal of a hospital is to care for patients. On the other hand, a hospital without money can't provide the highest level of care. When a hospital CEO job is described, you will hear a lot of high-sounding phrases like this. The primary goal of a hospital CEO is to create an environment that operates efficiently, offers high-quality patient care, meets the needs of its staff, and benefits its community. I have no real idea what that means in any practical term. Essentially, these types of descriptions are bandied about constantly and have little practical meaning. The US Bureau of Labor Statistics, BLS, outlines a CEO's core responsibilities, which include the following items: setting the goals, policies, and procedures of the organization, overseeing financial and budgetary operations, negotiating and approving contracts and other agreements, hiring department heads and managers, identifying processes that can be more efficient and cost-effective. In addition, the hospital CEO job description includes ensuring that care policies are compliant with all laws and regulations. CEOs are also responsible for fostering, leading, and growing a work environment that promotes worker and patient safety. But the million-dollar question is, how do these words translate into day-to-day decisions? The Horowitz law firm recently called Dr. Paul Hoffman, president of the Hoffman Healthcare Group, as an expert witness at trial. We asked him this very question. Dr. Hoffman has worked in the healthcare field for over 45 years. He has held positions as Executive Vice President and Chief Operating Officer of the Alta Bates Corporation, Executive Director of Emory University Hospital in Atlanta, Georgia, and Director of Stanford University Hospital and Clinics in Stanford, California. He framed his answer in terms of public safety and patient interests. Here is Dr. Hoffman's answer. The CEO is essentially responsible for the overall performance of the organization, both clinically and financially, and he or she is held accountable by the governing body, which has the ultimate responsibility for the performance of the organization. And I often refer to the board as the community's conscience. In other words, the governing body, and in turn the CEO and his or her colleagues, are responsible for assuring that the organization is performing in a way that serves the best interests of patients, both from the point of view of quality of care as well as the fiscal health of the organization. So patient safety and quality of patient care is at the forefront of the responsibility of the governing body as well as the senior executives, including the senior physicians who are members of the hospital staff. Even for-profit hospitals receive significant government money. Recently, in President Trump times, we are seeing how compliance with federal mandates, federal direction, and law can condition receipt of funds. However, this use of government power to shape practice is not new to President Trump. It has been a condition of receiving Medicare, Medicaid, and other federal money in a hospital setting. This is one of the prime reasons that being hospital CEO is not the choosing how much to charge for a signed photo of Mickey Mouse. Sadly, many hospital executives forget this, and our lawyers at the Horowitz law firm often are forced to intervene to protect doctors and patients.
The Horowitz Law Office specializes in physician defense. Daniel Horowitz has been a law professor and has taken over 200 cases to trial. If you are a physician in need of a warrior to protect you against a hospital, peer review, or the medical board, call Daniel Horowitz at 925-283-1863. Thank you for watching our video.